And when risk is predictable, prevention is possible. How do we protect recovery and reduce harm during a season where both individual and structural risk are at their highest? Safety is not the absence of threat, but the presence of support.
Hello, and welcome to the Transformed Mind, the podcast where we explore the real world intersection of mental health, addiction, and transformative care. I'm your host, Dr. O, and with each episode, we take a very thoughtful, practical, and evidence informed look at how we can improve psychiatric and addiction care from clinical settings to community spaces. If you're new here, here's the vibe. Host RX is just me and you. We're breaking down the research and we're sharing what really matters for our work. Expert RX brings in brilliant minds from the field, clinicians, researchers, and change makers. And Lived RX, that's where the real life stories come in. Guests who have lived it, survived it, and are shaping the system because of it. And today, if you're tuning in, welcome, welcome, welcome. I am so glad you are here. This is the season finale. And I am so excited you're here.
Can
Can't
improve
believe
psychiatric
we've
and
made
addiction
it this
care.
far.
From
Thank
clinical
you
settings to
for
community spaces, we hope to
listening,
bring the best care
learning
to the
with
people that
me,
we
and
serve. So it
going
has to be
through
a collab.
each episode with me. Over the course of the season, we have explored what it really means to practice evidence based, humane, and equitable care in the context of substance use and psychiatric care. We have talked about medications, policies, housing, emergent drug trends, and the system that either protect or endanger people's lives. For this final episode, I want to do two things. First, I want to reflect on what this season has taught us. Second, I want to apply those lessons to one of the most clinical and emotionally complex times of the year, the holiday season. Because if there's one message that we have echoed this season across every episode, it's this: risk is predictable. And when risk is predictable, prevention is possible. This season of Transformed Minds focused on the core question: what does effective, ethical, evidence based care actually look like in the real world? Let's briefly revisit the themes that shaped this year. We began by talking about integration, how embedding addiction care into community mental health settings improves outcomes for people with co-occurring disorders. Thank you to Dr. Ayana Jordan. That opening episode set the tone for what we went through. Siloed care fails people, especially those with complex needs. So we need collaborative and integrative care. From there, we confronted the change in drug supply, including critical episode on xylazine, often called tring, and what clinicians must understand about overdose risk in a contaminated market. We examined youth substance use trends with Dr. Gomez. We discussed with her the grounding prevention conversations in the national surveillance data. Rather than fear-based narratives, we spend times on medications for opioid use disorder, including buprenorphine in pregnancy, and later return to the issue of access, asking why evidence-based treatment remains so difficult to obtain despite the overwhelming data supporting its evidence. We are so grateful for Dr. Bo, who came to tackle this important issue of access with us. We tackled substances often misunderstood and minimized, like kratom, benzodiazepines, and the very real forms of abrupt discontinuation and unsafe tapering, directly from updated clinical guidelines put together by multiple professional organizations, including the APA and the ASAM. And we return to what might be the most consistent theme of the season: social determinants of health, right? In the two-part series on housing and later in conversations about homelessness and untreated opioid use disorder, we had Dr. Chapman, who discussed the evidence was unmistakable. Recovery outcomes are shaped more by stability and access than motivation alone. We also had Dr. Arbello, who discussed this as well, right? That we really have to take care of the marginalized population, including those that are unhoused. We learned the different types and kinds of homelessness. So, why does all of this matter for today's episode? Because the holidays magnify everything that we have discussed, from the stress to the trauma reminders, disrupted routines, reduced access to care, increased substance availability, and system slowdowns that put more people at risk. Which brings us to today's guiding questions. How do we protect recovery and reduce harm during a season where both individual and structural risk are at their highest? Here are three findings worth grounding ourselves in as we move forward. We know during the holiday season, emergency department visits for substance related harms increase between Thanksgiving and the New Year's, particularly involving alcohol and opioids. Trauma research also shows that seasonal transitions and family related stressors can reactivate cravings and trauma responses. This is a study in the Lancet Psychiatry. The national data has also consistently demonstrated that treatment engagement drops while overdose risk rises during late December to early January. That's what the SAMHSA data shows. So, the central question for today's episode is the same one that's guided the entire season. How do we reduce the harm and support recovery when both the individual stress and the system strain are at their highest? We want to put a few things together for all of us at home, whether you're a clinician, you're a trainee, you're a physician, you're a scientist, policymaker, you're a friend, you're a mother, you're a sister, a brother, you're a child, daughter, whatever role that you fit in this season, we have a few thoughts for you. These are some of the questions that we have. First, across psychiatry, social work, trauma research, and public health, the literature converges on three consistent explanations for why the holidays increase substance use risk. The first one is the stress psychology. The research shows that chronic and acute stress activate a neurobiological pathway associated with craving and compulsive use, whilst impairing executive control. The second is the trauma activation, right? Most of the time, we're spending our holidays with families, and sometimes that family dynamic, lost anniversaries, if you've lost someone, like your mother, your sibling, you've lost relationships, social expectations. When family comes together, people may be sharing their achievements. Families may be reminding you of the expectations they may have had for you. For instance, if you're from an African or an immigrant home, we have this running joke of parents and aunties and uncles competing whose child is the most educated or is the smartest, right? It happens for real. And this can be a tough time, especially for people that may feel like they haven't achieved enough, right? So, those family dynamics, loss of anniversaries, and social expectations that activate trauma memories is that second reason that's been found. Trauma informed literature has made it very clear that substance use in these moments often functions as survival, not defiance. So someone may be drinking more to numb the feeling, right? If they lost a family member or they lost a relationship, and the holidays is a reminder of that, they may be drinking more, or someone may not want to deal with people, so they may be smoking something just to calm themselves down. So most of the time, what the studies are showing is people are using not because of defiance, but because they're in survival mode. They're trying to survive this season. The third thing that has been shown is structural vulnerability, right? Most clinics are closed on the holidays. My clinic is closed on Christmas Day. It's closed on New Year's. Staffing, even in the places that may be open, staffing may be thin, right? Everyone wants to be home to spend time with their family, and they should be home to spend time with their family. But that may also mean an access gap for someone that may need care or someone that may need support, right? You may want to call your therapist, but your therapist is also home with their family during Christmas, right? So let's say you hit a block with your family, your therapist is busy. They're home with their family as well, right? And so these are some of those access gap during this time that can cause that structural vulnerability, right? Pharmacies reduce their hours. So if you needed some over the counter medication or you needed something from the pharmacy, you may not be able to get them during the holidays. Harm reduction services are scaling back during the holidays. There is a lot of predictable disruptions that increase risk, regardless of the individual motivation that may be happening. The central problem is not lack of willpower. It's not really because you don't have the will to do it, but there's a mismatch between predictable seasonal risk and insufficient system preparations. So, what does the evidence say about preventing relapse during predictable stress periods? Well, the evidence shows that anticipatory planning, increased contact, and continuity of care can reduce recurrence and overdose risk. So during the holiday seasons, because we know that the holidays are coming and our risk may be elevated during this time, and there may be some systemic and structural vulnerabilities. There may be some stress physiology and trauma activation that's going on. Some of the things that you can do to mitigate some of those risk factors is anticipatory planning, right? So you're anticipating that there may be a problem. So, what can I do? Right? What are some of the strategies I can put in place to prevent things that may happen? Or even if things may happen, how can I minimize that risk? Increase in contact, right? So, actually plan to spend time with people, having people around you so you're not alone. Continuity of care. So, for people that may be on my high risk list as a clinician, some of the things that I do or I've planned is seeing them right before the holidays and right after the holidays. So on Christmas Eve, I'm seeing some people. Best believe I'm going to be seeing some people on Christmas Eve. If I'm seeing you on Christmas Eve, it doesn't necessarily mean you're high risk. But there are some people I want to see that week leading up to the holiday and right after the holidays to make sure that there's that continuity of care and we're holding them and we're able to reduce that risk of recurrence and overdose possibly. How should clinicians proactively adjust plans before the holidays begin? If you need to give an early refill, knowing that the pharmacy is going to close, please try to do that, especially for drugs that are not controlled substances. We know there's a federal regulation for controlled substances, right? So you get it when it's due. But for those medications that are not due, is if you can give an early refill, try to coordinate care with the pharmacy, knowing that the pharmacy is going to be closed on holiday. And if someone rents out of their medication, they run the risk of decompensating, right? While flexible scheduling, doing telehealth check-ins, even if it's just a phone conversation to just check in on someone, right? I just gave a family a call to say, hey, how's it going? How are you guys doing? I haven't heard from you guys in a few weeks. I know we have an appointment coming up, but I just want to check in on everyone because I know they're having a hard time. Explicit relapse prevention plan and improve outcomes. Actually coordinate and care with your entire team, right? Today I was sending a lot of messages. I was like, hey, if you have any opening, can you check in on this person? Let's double, what's the word? I don't know what the word is, but basically, we're both targeting, right? So I'm seeing biweekly. Can you see every week? So I've decreased from every 4 weeks to every 2 weeks, right? Getting the therapist to also loop in. Can we get this person to also attend groups multiple times out of the week, right? If we need to refer you to a higher level of care, can we do that, right? Whether it's partial hospitalization, an intensive outpatient, whatever it is, we're making sure we're actually setting an explicit rehab prevention planning for you. If you need to be on a medication assisted treatment to help with that, we're doing all of those things so we know we're actually putting around you a buffer and a cushion for you, especially during the holidays. What does ethical harm reduction looks like when abstinence isn't immediately achievable, right? Because we have to understand there are going to be people who are not ready or they may not be ready to completely abstain. But that doesn't mean that we can't help them to reduce their risk. If it's just giving them some naloxone during the holidays, when we know that studies are showing the overdose risk increase, making sure they have some Narcan at home, making sure they know how to use that Narcan, safe use education. One thing that I would always tell people, do not use alone. I know in my state there's that service of call in someone so you don't use alone. And what that person is going to do, that if they don't hear from you from the other end of the phone, they're going to call for an intervention. They're going to call 911. They're going to call someone to come in. They're going to call crisis intervention to come in because we didn't hear from you. So if there's an overdose, we can intervene quicker compared to if you use alone and no one comes in. And sometimes by the time someone walks in, and find the person is too late. Educating people, testing kids, syringe exchange programs, non punitive engagement, right? All the things that can help and have been shown to help. There's a study in the New England Journal of Medicine that actually shows that Narcan distribution, safe use education, non punitive engagement actually will reduce overdose death without increasing substance use, right? Because most of the time, the fear is we're enabling these people with harm reduction strategies, we're enabling them to use more, right? But a study is showing you can actually reduce overdose deaths without increasing substance use using these tools. So, some of these are tools that can really help during the holiday season. How do trauma histories uniquely shape holiday substance use patterns? If you remember, one of the things that research has shown is the holiday seasons may be a higher risk season because of trauma, right? So, how do trauma histories actually shape the holiday substance use patterns? And we see that seasonal stressors actually can reactivate traumatic responses, right? Increase in cravings and dissociation. So, if someone, again, let's say someone had a misunderstanding with a family member or a friend, or something happened around the holidays, any of those things, right? This is a time where you're spending time with those people, you're spending time with those family members. And sometimes they say your loved ones, maybe the ones closest to you, may be the ones that may hurt you the most. But you're spending these time with them, right? You're reactivating, or people, even people that may not be spending time with their families, right? Seeing everyone spend time with their families may trigger pain or trauma that they may have suppressed, right? The people that may not be spending with their fathers or their mothers, right? The people that may not be spending with their children because there may have been some misunderstanding and now they're estranged from each other. The people that may have lost their family members, all of these things, just even being on social media, scrolling and seeing people post, right? Sometimes it's as simple as seeing everyone post their partners and you don't have a partner. You may feel lonely, and that can trigger an increased cravings and some dissociation. So just being mindful of these things and being mindful of what your triggers are and the strategies that can mitigate those triggers. So you're not now in a spiral moment and you're having cravings and there's a lot of substances around because it's the holidays. And unfortunately, you're going to have recurrence of that use. What role does medication continuity, especially medication for opioid use disorder, play during clinic disruptions? So, even a brief gap in treatment can increase mortality risk. Stopping someone's medication, they could go into withdrawals, or someone missing a dose of their medications, they could go into withdrawals. Those withdrawals can lead to seizures, like, or because they don't have that one dose, they can just be like, I don't want to go through these withdrawals because they're very terrible from how people have expressed and explained what happens to them from what I have seen people go through. Withdrawals are not, they're not for the weak. They're terrible. Very, very terrible. They can be really bad, right? And some people may not want to go through it. All I need to do is just take the drug or take the substance and this can go away. Some people would go back to use and sometimes that can lead to an overdose, right? So that's where we start seeing that mortality risk increase. How can patients recreate realistic recovery plans rather than rigid? So trying to use very flexible, value-based recovery planning can reduce disengagement after lapses. So one thing that sometimes I suggest for people that may be having a hard time is RAP. And RAP is actually a recovery action plan that's made by individuals with lived experience. So it's not made by doctors, it's not made by therapists. It's literally made by peers, people with lived experience that have put together this recovery action plan. And sometimes it may not directly fit to your exact problem, but you can look through it, get some ideas, and pick up some strategies and taper it to your specific scenario. So when meet people that may be having a hard time figuring out their triggers or picking up ideas and coming up with strategies, yes, I can suggest strategies for you. But sometimes the most used and most beneficial and compliant strategies I have seen are the ones that the people come up with it themselves, right? So I think, and even just rap, I've seen it help people, and I have people that have literally taken on. This really didn't fit me, but I was able to come up with this intervention plan and strategies for myself and my support team to use, and it actually speaks to my condition and my concerns, right? What community level interventions reduce overdose risk during the holidays? Naloxone distribution, syringe services, all of this can reduce mortality. I know places may be closed, like pharmacies, clinics, all of that, but just having a space where people can come to in case they need someone to talk to. I think that's actually a good idea. I need to look into it and see if there are any around my area, like the soup kitchen and all those places that actually open up for Thanksgiving and Christmases for people to go in to eat. People that don't have families who are alone, or even those that have families that want to go. So I think these are good resources for people to use and look into during the holidays. How do policy decisions about clinic hours and telehealth actually affect mortality? There are a lot of barriers, right? But telehealth expansion has actually been good in this context in the sense that it helps and increase access, right? So somebody may not want to go in, but they'll be willing to spend time with their family, open presents in the morning with their family, and in the afternoon see people, right? Because they're home. They still get to be at home and spend time with their family. They could have traveled to see their family, but still may be able to, depending on the state regulation, if it's someone that's licensed in multiple states, they'll be able to still see the person and do what they need to, right? So that telehealth expansion and reduce administrative barriers. Oh, that's a huge one. We're clinicians. Those administrative stuff, right? So Actually, reducing those administrative barriers, if you're policymaker, you're listening, that can really improve attention and survival. That's what the study shows. So, I think it's important that we also shift individual blame to systemic accountability and move from the stigma and the idea, like I said, it could be trauma, it could be stress, it could be a lot of, it could be systemic vulnerability, right? This person does not have willpower, it's not moral failure, it's a predictable event that, and we know risk factors surrounding it. So I believe as a system, we need to take some accountability and we need to start evaluating access continuity and policy barriers rather than just focusing on individual behaviors. Like, I think once we start assessing all of those things, including the access gap, the continuity gap, the policy barriers that's holding some people back and increasing the risk, I think we may be able to make progress and actually decrease that risk and mortality level that happens during this time. I truly believe that. So let's discuss a case. This is a 38-year-old individual with opioid use disorder. They've been stable on buprenorphine for over a year. December is approaching. So they're sharing, they've come to see you. They're sharing, I have some increase in my cravings. I'm not sleeping well. There's a financial strain because I have to buy all these presents. I have to make sure my kids have these presents so they don't feel left out. I have all this anxiety about spending time with my family, with all the family conflicts. I had a fight with my sister the other day, but their clinic is going to be closed for several days over the holidays. From a clinical perspective, anticipatory cravings are expected, as we've discussed, right? The evidence supports proactive planning and medication continuity, right? So these are some of the things that we're supposed to be doing for the individual, right? We have to make sure we're doing a proactive planning. So though the clinic is going to be closed, they have enough medication. So if you can refill earlier, you do that. If this person appears to have some concerns and the risk level maybe a little higher than the average person, they're having cravings, they're having disrupted sleep, they're stressed, right? Financial strain, they're having anxiety. So maybe it'd be a good idea to see the person before and after the holidays, before seeing them, assessing the risk, coming up with a concrete strategy of what are the things that you can do when you're having cravings, right? So, what are they having cravings for opioid? What are some of the things that you can do for your opioid cravings that can help? Are they on medication? If they're on Suboxone, is the Suboxone therapeutic dose, right? How bad is their craving? What can they do? Do they have support? Do they have like family support? People that can help them? Do they have Narcan at home? What are some harm reductive strategies? Have you educate about safer use, right? All of these things would be proactive planning the person for better outcomes, right? So you're reducing that risk. Making sure you're doing all of these things would really help that individual. So, if you're a clinician, I want you to remember that there's a higher risk during the holidays. Anticipate that risk and plan and adjust care accordingly and earlier on, right? If you're a student, I want you to know relapse risk is not just behavioral, it's seasonal and it's structural, right? There are all these risk factors that go into play. If you're a policymaker, we are begging, please help us. Help us advocate for policies that bridge that access gap during the holidays. and help minimize these preventable contributors to harm that rises during the holidays. And for the public, recovery depends on support and not willpower. Someone can have all the willpower they want, but they need that support well. Provide them with the resources and support them well. Safety is not the absence of threat, but the presence of support. Thank you so much for being a part of this season. Thank you for listening. We are so grateful for you. Thank you for supporting. Thank you for sharing. Happy holidays. Enjoy your holidays. Stay safe. And please remember, safety is not the absence of threat, but the presence of support. Be there for your family, be there for your community, and let's look out for each other. Happy New Year in advance. See you in the new year when we come back with a new season filled with so much more. We are excited and we'll be coming back in February. Thank you. And as always, stay ready, stay aware, and stay grounded. Thank you.